Hi, my name is Rob Welk, and I'm going to help you understand how to save thousands of dollars on your health care, your health insurance, and the taxes that are related to it by giving you a better understanding, showing you how you can implement changes that would make things work more in your best interest. So today I want to talk to you a little bit about the medications. So when you're taking medication, unfortunately, 12 to 20% of the cost of healthcare is just prescriptions. It can become quite daunting very quickly, particularly with the large deductibles that most plans have. So there's a couple things you can do that'll save you some money. The first thing is you can use a piece of software called GoodRx, and what GoodRx does, it goes on your phone, is it calculates the lowest cost for your medications within the radius of your phone. They do have a contracted rate for those medications, and so therefore if the cost on that software is lower than what your insurance card would give you for your health insurance company, then you should take that. If it's more, then you take the one provided by the insurance company, because a lot of that's determined by contract. The second thing you can do is talk to your doctor about the medication if there is the ability to split that. And I bring that up because some insurance companies actually require that. The pricing on many medications is flat price. So you might have 10 milligrams and 40 milligrams, and the difference in the price might only be 5 or 10 or 15%. So yeah, you double it up, cut it in half. That's something you should discuss with your physician. Obviously, there are sometimes generic alternatives. What you'll find is that every insurance company provides you what's called a formulary, which has a list of medications along with all the little tiers. And if you are able to get a hold of the page that has your medication on it, it's likely to have all of the alternatives, and it makes it very quick and easy for the doctor to look at an alternative and quickly make a decision of what he can have you take. I bring this up because you would think that doctors would know what medications are on what tiers. It's hard. There's a software they can use. When I was a drug rep, it was on a handheld device, but it's not 100% accurate. Quite honestly, it does change because companies can change what's on their formulary and what's not all the time. So what I would suggest is if you're given an expensive medication, you call the insurance company, ask them to fax you the page or mail you the page that represents the medications that are in that category, in that class of medications. Provide that to your doctor, see if there's an alternative that works. Other things you can look into is mail order. When you use mail order, it cuts out some of the cost of the middleman, so sometimes that'll drive down the cost. The other thing you can look at is the manufacturers. If you go to a website by the name of Needy Meds, NEEDYMEDS.com, you'll be able to look up your medication and see how you might be able to get either some kind of discount program. There's two types. There's one that's called a patient assistance, where they reduce or eliminate your copay when you have one. Those programs tend to be a little more generous income-wise. The second way is second form of help is what's called a patient assistance program. And if your income qualifies you, then they simply give you the medication for free. And you print off a 1 or 2 page application, you fill it out, you give it to your doctor, he fills out some of it, he mails it in. They may request some income verification or asset verification depending on how their plan works. And then the medication is mailed to your doctor's office usually, and you pick it up there. Now, keep in mind, each of these programs are different. They do change. Usually once you're in a program, they don't boot you out. And it is a little bit of hassle because it's very personal. They're asking a lot of personal information about yourself. But again, the majority of the cost of drugs is a handful of drugs. So if you happen to be unfortunate enough to take one of those, it's worth the effort. Other things you can do is ask your doctor if there are clinical trials going on with that medication, because if that health condition you have is, if you're not taking other medications in combination with it, sometimes you would be an ideal candidate for that. Or maybe you are taking medication and that's what the study's about. So that's something to think about. Samples are important because, particularly if you're on Medicare, some kind of Medicare program, because there's a limit on how much benefit you can get from your drug plan before you drop into a gap. And so when you're getting samples early in the year, oftentimes people are pretty flush with their limits. Later in the year, they're not. So it's a good idea to get samples earlier in the year. It's a good idea to visit all your doctors and ask them for samples, not just one. You might also ask them for coupons. A lot of times they have coupons that they never give out because nobody ever asked or they forget about it. and those coupons give you a free 1 month or several months supply. So hopefully that helps you with some medication cost questions. There are other things that we recommend to clients that we can talk about on a one-on-one basis, but that's the gist of it. We can reach here at 509-443-5416. Our costs doesn't cost you anything to use us, doesn't affect your benefits in any negative way. We offer walk-in traffic, and we have a full-time tax person to help you out with tax-related questions. So I appreciate your time. Thanks.